Hi, my name is Cordial. I'm a physical therapist and I'm the founding partner for the PT Group. The PT Group was founded over 30 years ago in the Greensburg area to fill a need for a very high level of physical therapy to treat lower back patients. From that, we expanded into treating other injuries such as orthopedic and sports and balance injuries throughout our 20 offices in Western Pennsylvania. The hurdles to outpatient physical therapy 30 years ago was two things. One was that you had to get a physician referral to see the patient for any type of rehabilitation, and secondly, all care was done on an inpatient basis or in the hospital setting. So the outpatient model had not been developed as it is today. So at the time, the PT Group was the first to develop the outpatient model in our area for physical therapy services. We felt this would not only help our patients from a rehabilitation standpoint and having highly skilled programs, but also the fact that we could provide them convenience to meet their lifestyle requirements to be able to be seen for physical therapy 3 days a week, which most people do come multiple times per week, making it challenging to fit into their lifestyle and their schedules. I think that the obvious future of physical therapy, if you look at the educational process, that physical therapy has gone from a bachelor's degree to currently it is a PhD program at all universities. The APTA goal by the year 2020 is to have all practicing physical therapists have a doctorate degree. And the movement towards doctorate degree is to train physical therapists to be able to evaluate and perform differential diagnosis to allow the direct access process to continue to expand. Most people are not aware that within the last 5 years, the Physical Therapy Practice Act has been changed to allow physical therapists with the right amount of training and experience to apply for a direct access license. If they apply for that license and are eligible to receive it, then patients can seek out care by that physical therapist without going through the process of getting a physician referral. That therapist can then treat you for 30 days for that diagnosis, and at the end of the 30 days, if you're not improved or completely rehabilitated, then the therapist needs to make a referral to a physician for further workup of your injuries. What this allows you to do is to start your rehabilitation much sooner as compared to waiting for a doctor's appointment to get the referral and then scheduling your care. And our internal studies have shown that the sooner we start rehabilitation on a patient, the quicker they are able to complete that rehabilitation, and also the result also improves as compared to waiting longer periods of time to begin your rehabilitation. Direct access allows us to start a patient within the next business day of them calling our office for an appointment. The model in the past, or the thought processes in the past, is that all physical therapy is the same. But quite to the contrary, there is a big difference in physical therapists and physical therapy providers. At the PT Group, we take a lot of pride in the way we provide our physical therapy care and the whole patient experience, from beginning and registration through seeing the same physical therapist every visit through discharge, with our goals being to discharge those patients as soon as possible at the highest level of care, thus saving them money on copays, in addition saving them time and energy out of their busy lives and lifestyles. When patients are making their choice for physical therapy, they really should seek out a therapist who specializes or is highly trained for the type of rehabilitation that they need. Today, therapists do specialize in different areas of care, and some of those areas which the PT Group specializes in is orthopedic and sports rehabilitation, as well as balance therapy. So the PT Group is a very high-skilled provider in those areas. If a patient is able to seek out a provider who is more skilled or trained to handle their situation, then obviously they'll end up with a better result in a shorter period of time. The physical therapy model versus the chiropractic model is that the chiropractor is the active part of your care, that they will do something to you to improve or rehabilitate you. In the physical therapy model, it is a team effort where the therapist works with the patients, and in addition to putting their hands on the patient and doing highly skilled mobilizations and other techniques, our physical therapy programs include exercise for range of motion, strengthening, but also actively involve the patient in the home programs and also their lifestyle changes that they may need to make to protect their injury during the rehabilitation process as well as in the future. In addition, the physical therapist will teach you how to manage your condition should you have a flare-up or re-injury down the road, which may save you visits back to the doctor and or to the physical therapist. Physical therapists rehabilitate all portions of the body, which chiropractic is limited at doing. In addition, it's important to note from an insurance benefit standpoint that if you do get chiropractic care is lumped into physical medicine. So therefore, if you have visit limits on your insurance plan, if you go through chiropractic care and at some point need physical therapy care during that same calendar year, those will count towards your visits for rehabilitation and could limit you to the amount of rehabilitation that you could receive. And it's also as simple when you see a chiropractor, they can do something as simple to you as an ultrasound and really not a full visit or a full treatment. That will count as a visit towards your rehabilitation program or towards your rehabilitation visits in your insurance program, therefore limiting you in your visits if you should need more extensive rehabilitation by a physical therapist sometime in the future. Thank you for watching and seeking out information on the PT Group. If you're watching this webcast because you or a family member or friend are having injury or illness problems that may need physical therapy, please feel free to visit our other webcasts and podcasts to find out the top 10 reasons to choose the PT Group as your rehabilitation provider. Or also call our toll-free number to see if you are a candidate for our free evaluation. In closing, I wish you good health and success in your rehabilitation program.